Speech Secrets.
Hi, it's Kasondra and welcome to Speech Secrets. Today we're going to go over 5 tips for people with Bell's palsy. And these tips are coming all the way from Germany from my friend and fellow creator SL Therapy Online. Carolyn, are you there?
Hi Cassandra, great to see you.
Hey! Thanks for joining us.
Yes, I would be pleased to share some tips with you that I use with patients with Bell's palsy.
Let's start with the basics. What is Bell's palsy?
It's a paralysis of one side of the face caused by a virus or inflammation.
What are your 5 tips when someone has this?
First, it's important to understand that the damaged nerve needs time to recover before it can again transmit signals from the brain to the muscle to trigger movement. Depending on the severity and the location of the damage, this can take several weeks or several months. You can support the recovery process with facial massages. It's also good to keep the healthy side calm and relaxed to keep the face as symmetrical as possible in rest. Now the second tip. When the eye doesn't close completely, it's very important to keep the eye humid during the day and the night with eye drops and eye ointment. During the night, the eye should be held close with a special tape. You should also perform manual blinks with your clean fingers, either one finger or with 2 fingers, often during your day. Inflammations of the eye can in the worst case lead to a vision loss. Now let's go on with the next tip. When the nerve recovery allows small movements of the facial muscles, you can perform exercises to retrain coordinated symmetrical movements. It's important to do very small and gentle movements. Our natural facial expressions are modest facial movements and not overly exaggerated movements. You should always focus on keeping the symmetry on both sides. My next tip is that it would be good to get a feeling for the activity of the individual muscles. As time progresses, defects in the recovery process of the damaged nerve may lead to synkinesis. Synkinesis is when there are simultaneous involuntary movements of other facial muscles or an overactivity of certain facial muscles. You may think that your face is still weak because it's partly immobile, but instead the cause may actually be muscles constantly contracted too tightly. When this occurs, you can stretch them and massage them regularly to improve the mobility and the symmetry of your face. I'm now coming to a practical tip. For example, an overactive tense ring muscle of your eye may keep your eye on the affected side smaller and half closed. You can stretch this ring muscle around the eye gently and regularly several times a day to support its relaxation. Now here's how to stretch the muscle around your eye. Hold the tissue above the inner corner of your eye with one hand and pull outwards towards the temple with 2 fingers above the upper eyelid. Several times and gently. For the outer part of the ring muscle, hold the tissue at the outer part of the eyebrow and draw downwards towards the cheekbone with your other hand. For the lower part, you will hold the tissue below the inner corner of the eye and gently pull with 2 fingers of the other hand outwards. On my channel, you'll find more videos with stretches and exercises for the different facial muscles and also oral motor exercises and tips for swallowing problems.